Periodontitis is a chronic disease that affects one person out of two, and in countries with a high standard of living is the main cause of tooth loss. It is caused by widely spread pathogenic microorganisms which succeed in establishing a complex interaction with the patient. In this way, these microorganisms are able to survive for a long time in the oral environment, eluding the conventional antiseptic and antibiotic treatments and causing a status of chronic inflammation, which in the long run damages and destroys the gingival and osseous tissues that support the tooth. Recent studies have demonstrated that periodontitis microorganisms are able to elude the conventional antiseptics, penetrating inside the cells that form the gingiva. From here, they can spread into the blood, for example while chewing or during dental operations, colonizing various organs, such as the heart. In fact, it is demonstrated that not properly treated periodontal disease predisposes to serious diseases of the cardiovascular system, such as angina pectoris, heart attack, arteriosclerosis, strokes. The complete removal not only of the plaque and tartar, but also of all the contaminated gingival tissues surrounding the teeth that may contain hidden microorganisms is the fundamental requirement for the success of the therapy. No dental technique has been able up to now to safely, effectively, and painlessly ensure the complete removal of the infected gum. Now, progress in the development of lasers for biomedical applications has made this aim fulfillable by the dentist. Expert medical researchers, with the support of in vitro and in vivo clinical studies, accepted and published in prestigious and international medical and dental journals, have developed and defined a new, effective, and safe treatment methodology. As a consequence, a new technology is being conceived, combining in a single device the resources required for the treatment and diagnosis of soft tissues. Dental Laser System 4x4. The activity of photoablation consists in the complete removal of the contaminated epithelium. In the photoablated zone on the treated area, the natural formation of a keratin biofilm occurs, a film that protects the underlying gingiva and promotes quick healing. This biofilm can be highlighted with a diagnostic LED source emitting a 405 nanometer light included in the machine, emphasizing a specific luminous area, fluorescence, which allows the operator to sharply evaluate the extensions of the treated gum. The thermal control is performed by means of an infrared thermal camera with temperature sensor included in the machine, making it possible to monitor in real time the tissue temperature. To avoid the thermal damage of the treated tissue, the laser equipment is provided with a further safety mechanism that automatically switches off the platform if, during the treatment, the operator exceeds the temperature threshold set by the dentist. The photoablation activity, effectively and safely carried out with the selected infrared laser source, also produces a hemostatic action that closes the blood vessels and makes it hard for the microorganisms to spread through the bloodstream. The laser irradiation does not require anesthesia, with obvious benefits for the patient and the outlook of quick healing. The stagnation of the blood vessels and the elimination of the contaminated gingival tissue facilitate the execution of SRP scaling and root planning procedures, since they make it possible to result in very little bleeding and reduce the possibility of periodontal germs disseminating in the bloodstream. Bacteria and their toxins, gram-negative lipopolysaccharide, can infiltrate even in areas not accessible to the ablative action of laser, for example, the internal root surface or the tissue surrounding the tooth. The Dental Laser System 4x4 is thus equipped with a second laser source, highly penetrating and specific for photoactivable antiseptic substances. These substances have special photochemical properties, which make them particularly versatile and effective against pathogenic oral microorganisms. These substances in fact absorb light at specific wavelengths, exciting and producing free radicals of oxygen with a powerful antibacterial action. These photoactivable substances have been specially formulated to facilitate their penetration into gingival and dental tissues, even within the cells parasitized by pathogenic microorganisms. The combined association of photoablative and photodynamic laser therapy, easy to perform thanks to the versatility of the dental laser system 4x4, has been proven through scientific research, histological and clinical trials published in international medical journals to be by large much more effective than the conventional dental procedures in healing the periodontal disease. The pathogenic germs, in fact, are definitively eradicated, as well as the signs and the symptoms of gingival inflammation, with the complete disappearance of periodontal pockets, even if they are very deep. In many cases, this makes reconstructive gingival surgery unnecessary, with a clear advantage for the patient and the dentist. Dental Laser System 4x4 integrates on a unique platform all the resources required for the performance of the photoablation photodynamic PAPD therapeutic procedure. Furthermore, it is the first equipment to be provided with diagnostic devices to control and monitor treatment's performance and verify their efficacy, helping the operator to ensure treatment safety and effectiveness.